Welcome to Champions of Care, brought to you by Oakwood Healthcare. I'm Mary Zatina. Today on our show, we're going to talk about teaching hospitals and medical education and how young, smart medical school students become the finest physicians in America today. I'm so happy we have an outstanding guest in our studio today. Please join me in welcoming Dr. Michael Geheb. He's Executive Vice President of Physician Planning and Operations, and he is a board-certified physician in internal medicine and nephrology. Dr. Geheb, I'm so happy to have you with us in the studio today.
Why, thank you, Mary. It's great to be here with you today.
Now, Dr. Geheb, I'd really like to understand this notion of teaching hospitals. I know you're very proud at Oakwood that you train so many physicians in so many specialties. Why is a teaching hospital a better place for a patient to get care than a non-teaching hospital?
Well, teaching hospitals have to be up to date in terms of their physicians and their clinical staff to be able to provide the most advanced care.
Aren't all hospitals up to date on care and what those physicians know?
Well, what's different about a teaching hospital is that the physicians who teach and who train and who practice there and who interact on an ongoing basis with students and residents really have to be up to date on their clinical knowledge and up to date on their clinical expertise. Otherwise, they can't teach residents and students as well. And those skills translate into excellent patient care because those are the physicians who see our patients.
Now, I understand you have a number of different what's called residency programs and programs in general. Can you talk a little bit about the depth and breadth and what a residency program is?
A residency training program is for students who have recently graduated from medical school and have chosen a given specialty, such as internal medicine or obstetrics and gynecology. And that training period after medical school can go from anywhere from 3 to 7 years. It takes 7 years to train a neurosurgeon. And during that particular time, those students and those residents learn the medical content, learn how to practice, and learn how to be clinical experts in particular areas.
Would a patient who's concerned about their own medical condition, do they worry that they're getting advice and counsel from a student who hasn't yet finished that lengthy process of becoming a full-fledged physician?
Well, I think the thing that's very good about the system is that students and residents provide additional eyes on a patient and expertise for a patient, and all of that care is supervised by an attending physician who has the direct responsibility for that patient.
So in my non-clinical terminology, that's a twofer, right? I get the student who's studied every aspect of this from their textbooks and their training, and I also get the seasoned professional who's maybe seen a lot of different cases which may or may not be like mine. So you get both.
That's exactly right, Mary. You get a chance of several eyes on your particular problem with an expert leading the team, and that's the attending physician.
Dr. Geheb, can you explain a couple of things I've heard terms used, fellowships and also board certification? Are those like bragging rights, and do they differentiate great physicians from those who are just good physicians?
Board certification is something that's very important to physicians, to patients, and to the public at large. Board certification represents the profession itself raising the bar on an ongoing basis. To be board certified means that you've had to go through a rigorous training program, as I just described, and at the end of that period of time, sit for a difficult exam. So when you go in your doctor's office and it says, your physician is board certified, it means they have been trained extraordinarily well and they meet the high standards that the medical profession has set.
For that particular specialty?
For that particular specialty. There are some 20 areas, and it's called the American Board of Medical Specialties, where different areas and different physicians develop the training standards for training. So that could be internal medicine, that could be neurosurgery, that could be obstetrics and gynecology. And coming out of medical school, students choose one of those areas and then they go into training for anywhere from 3 to 7 years.
3 to 7 years. That's a long time. So these are the super smart kids who've done real well in their primary school training, their high school. Then they've gone to 4 years of college in a pre-med curriculum. Then how many years is medical school?
Medical school is 4 years. So it takes 8 years in general to get through this process. And at that point in time, when you graduate, then you can go into a residency. And then there's an additional 3 to 7 years beyond those 8 years of training.
Wow. Now, what about fellowships? What's a fellowship?
The fellowship is a super specialized niche of training. For instance, if you've trained in internal medicine, you may want to become a cardiologist. That requires an additional 3 years of training on top of the 3 years that you had in internal medicine.
So by the time I find a physician who is board certified, maybe they've also done a fellowship, I know that they've been tutored by an experienced physician during that residency program, and their work has been overseen by a faculty member. And then if indeed they're board certified, a board of people in that same specialty have said, yep, he or she is really good at this. Is that true?
That's exactly right. And each of the boards puts together a rigorous exam, and some of the boards even require that you have individualized examinations.
So for those viewers who are watching today, what would you say to them is the best reason to choose a teaching hospital?
Teaching hospitals provide an environment of learning for its students, its nurses, and its physicians. It's where teams of individuals come together to provide care to each individual patient. It's where teams specialize in you.
So this environment of learning created because there's medical education going on has the effect of lifting all boats and elevating the overall quality of care at an institution. Is that fair to say, or am I overstating it?
That is fair to say, because the requirements to be a teaching hospital mean that the physicians have to constantly work at maintaining their knowledge base and maintaining their technical skills. It's a requirement to be a teaching physician. And all physicians who associate in that environment, it kind of rubs off on them.
Well, Dr. Geheb, you have taught me an awful lot about medical education, and I know our viewers have benefited from your insight. You are the Executive Vice President of Physician Planning and Operations, and you do that as a board-certified physician yourself. You're board-certified in internal medicine and nephrology, so you've brought a lot of personal knowledge to bear on our conversation today, and I thank you so much for being here.
Why, thank you, Mary. It's really been a pleasure to talk about these topics with you today.
Coming up, we'll be visiting Oakwood South Shore Hospital in Trenton, Michigan, and learning a little bit more about medical education and the physician training program that happens at Oakwood South Shore Hospital. Stay tuned.